Hi, I'm Dr. Jim McDonald, Commissioner of the New York State Department of Health. I'm pleased to share with you important steps we're taking to eliminate hepatitis C, a liver disease that can cause serious health problems if left untreated. In 2021, New York State released a plan to eliminate hepatitis C as a public health concern. If we're to achieve this goal, we will need to screen more than 10 million New Yorkers by 2030. The Center for Disease Control and Prevention estimates that 40% of people with hepatitis C aren't even aware they have it, meaning they're unable to benefit from the safe and effective treatments that are available. Beginning in May of 2024, new legislation will go into effect requiring healthcare providers throughout New York State to order hepatitis C screening for all pregnant people during each pregnancy. Providers are also expected to offer hepatitis C screening to anyone 18 or older and to individuals younger than 18 if there is an indication of risk, such as injection drug use. Let's first discuss why testing for hepatitis C during pregnancy is critical and what you can do as a healthcare provider to increase testing rates. Nationally, rates of hepatitis C within the obstetric population rose nearly tenfold over the last 20 years, leading the Center for Disease Control and Prevention to expand its hepatitis C screening recommendation to include all pregnant people. The American College of Obstetrics and Gynecology endorsed this recommendation. In New York, we are seeing a rise in new cases of hepatitis C, particularly among young people of reproductive age. Identifying hepatitis C infection during pregnancy is clinically important to guide prenatal and postpartum care for patients and their newborn. Studies have linked hepatitis C infection during pregnancy with worse pregnancy outcomes, including poor fetal growth and preterm labor. We also know that there is a 6% chance for perinatal transmission of hepatitis C, which doubles if the expecting person is co-infected with HIV and hepatitis C. One of the biggest barriers to testing is the stigma associated with injection drug use, the primary risk factor for hepatitis C. By widely screening all pregnant individuals, regardless of their risk, we can help eliminate the stigma of testing and facilitate timely linkage to follow-up care and treatment for those found to have hepatitis C. Simply put, add hepatitis C screening to routine prenatal testing along with HIV, hepatitis B, and syphilis. Order a screening test with reflex to hepatitis C RNA testing to ensure complete diagnosis. If the hepatitis C antibody screening test is reactive, a hepatitis C RNA test must be performed on the same specimen or a second specimen collected at the same time. Be sure to document hepatitis C test results prominently in the patient's medical record at or before the time of hospital admission for delivery. Discuss options for treatment with those patients diagnosed with hepatitis C. While hepatitis C treatment has not yet been FDA approved for use during pregnancy, promising clinical trials are underway. Consider treatment during pregnancy on an individual basis after discussing the potential risks and benefits with patients. While it is safe for patients with hepatitis C to breastfeed their baby, treatment should be postponed until the child is weaned. This has become more feasible with postpartum Medicaid coverage now being extended to 12 months. Also, remember to report the pregnant person's hepatitis C infection to the newborn's pediatrician so that hepatitis C RNA testing can be performed. Infants between 2 months and 6 months old can be tested, and if positive, they can be treated at the age of 3. In closing, the hepatitis C testing during pregnancy is an important opportunity to identify future care needs of expecting individuals and their babies. Hepatitis C elimination is within our grasp, but it will take our combined effort in testing. It's the first step. Together we can eliminate hepatitis C in New York State. Thank you. I'm Dr. Jim McDonald, Commissioner of the New York State Department of Health.